Ladies and gentlemen, welcome to sqadia.com. My name is Mohammad Osama, and today we are going to talk about imaging of vertebral column in terms of anatomy. First of all, we need to know the different anatomical structures whenever we talk about any region, and spine is one of the most important regions whenever we talk about the musculoskeletal anatomy or different neurological problems as well concerning the spinal cord. And once we know the anatomical features and the anatomical landmarks in the clinical practice, we need to identify those structures on radiographs and imaging as well, such as MRI and CT. And for that purpose, we need to be able to identify the normal structures as well as the abnormalities in those structures. And this lecture is going to be concerned with all of those issues. So in this series of lecture, we're going to talk about the anatomical features and investigation, in which we're going to talk about the anatomical features of the spine as a whole, including the vertebral bodies, the disc, and the joints such as the ancovertebral and the intervertebral and the zygapophyseal joints. Moreover, we're also going to talk about the investigation of choice in terms of imaging for different conditions related to the spine or the vertebral column. In the next section, we're going to talk about the cervical spine radiographs, in which we are going to talk about different types of radiographs, including the AP view, the lateral view, the oblique view, and the functional view as well. We're also going to talk about the swimmer's view, which is a specific type of lateral view. Moving on, we're going to talk about the reviews of radiographs in trauma, in which we're going to talk about the vertebral alignment, bone integrity, and disc spaces in terms of imaging and radiographs. And we're also going to talk about the prevertebral swelling as well as the stability of the spine. Moving on, we're going to talk about radiographs and imaging in neck pain. And that we're going to talk about the introduction of neck pain, what it is, and we're also going to talk about the X-ray imaging in neck pain and what are the features that we look for. Moving on, we're also going to talk about the magnetic resonance imaging and CT or computerized tomography scans in neck pain as well. At the end, we're going to talk about the thoracolumbar spine and low back pain and its perspective in terms of imaging and radiographs. And that we're going to take a look at the normal anatomy and how that presents in terms of imaging and radiographs, as well as we're going to talk about the transverse sections in terms of CT scans. We're also going to talk about low back pain and how we use radiograph to actually visualize the problems related to low back pain. And that's pretty much about the contents that we're going to cover in this series of lecture. I hope you learned something new out of it, and keep on watching sqadia.com for more lectures like this. Thank you very much.